What's up everyone and welcome back to the World History Channel. Before we begin, please hit the subscribe button today. Let's get started. What caused Jane Austen to die? Even after 2 centuries, nobody knows. Fevers, exhaustion, and a shift in appearance. Why modern doctors are still trying to figure out what the famous novelist was feeling before she died at 41. Jane Austen left behind only 6 complete novels and one of the most perplexing medical mysteries of all time when she passed away on July 18, 1817, at the age of 41. No one knows what exactly caused her death. But Austen experienced a curious assortment of symptoms late in life, ranging from recurring fevers and fatigue to stomach issues and concerns over her changing complexion. The enduring mystery has piqued the interest of scholars and armchair sleuths alike, who have proposed a variety of medical conditions to explain her death, including cancer and accidental poisoning. The act of posthumously diagnosing Austen is part of a larger cottage industry of retrospective diagnosis, the practice of applying modern medical knowledge to diagnose someone from the past. But can it shed any insight into Jane Austen's life and solve the mystery of her death? What we know about the illness of Jane Austen, born on December 16, 1775. Jane Austen appears to have had a relatively healthy childhood and young adulthood. Jane Austen was vigorous and active until her attacks of ill health in the last year or so of her life, says Juliet Wells, professor of literary studies at Goucher College and guest co-curator of A Lively Mind. Jane Austen at 250 at the Morgan Library and Museum. Her letters up until that point include numerous mentions of enjoying long country walks and dancing, frequently for hours at a time. Despite the fact that Jane Austen never got married, she was an expert at marriage. Around the age of 40 in 1816, while she was finishing the novel Persuasion, Austen's health took a turn for the worse. Her symptoms, which included rheumatism and fatigue, came and went, and she reported them in a series of surviving letters. On March 23, 1817, Austen described her complexion to her niece Fanny Knight as black and white and every wrong color, and observed, "Sickness is a dangerous indulgence at my time of life." In a letter to her brother Charles 2 weeks later, she complained that she had been too ill for the past 2 weeks to write anything that wasn't absolutely necessary. She was suffering from a bilious attack attended with a good deal of fever. Around that same time, her niece Caroline Austen visited and noticed the alteration in her aunt. She was very pale, and her voice was weak and low, and there was about her a general appearance of debility and suffering, but I have been told that she never had much acute pain. Jane made her will in late April, several months before she died, suggesting an understanding that her condition was serious, notes Devoney Lucer, Regents Professor of English at Arizona State University and author of Wild for Austen, a rebellious, subversive, and untamed Jane. The next month, Austen and her sister Cassandra moved to Winchester, England, where the novelist sought medical care for an unknown illness. According to Wells, Jane passed away in Cassandra's arms because the treatment was ineffective. A guide to Regency Bath on the anniversary of Jane Austen's birth. I have lost a treasure, such a sister, such a friend as never can have been surpassed, Cassandra wrote 2 days after her sister's death. She was the sun of my life, the gilder of every pleasure, the soother of every sorrow. Jane Austen's surviving letters, and those of friends and family, serve as the main sources for information about her death. But those letters don't give a full picture. In the wake of Jane's death, Cassandra destroyed many of her sister's letters, likely to protect her privacy and reputation, and unwittingly opening the door to rampant speculation. Did Jane Austen have lupus or Addison's disease? How did Jane Austen pass away? One of the most common theories is that Austen had Addison's disease, a condition in which the adrenal glands are unable to produce hormones like cortisol. This theory was first put forth in 1964 by a surgeon named Zachary Cope. Addison's disease causes symptoms like the fatigue and skin darkening that Austen's letters describe. But there is one problem with that theory. In 2021, emeritus consultants at London's St. Michael Sanders and Elizabeth Graham, both of Thomas's Hospital, both have an interest in Jane Austen lore and have pointed out that tuberculosis was typically the cause of Addison's disease during Austen's time. Both Jane's doctors, Curtis and Lyford, would have been familiar with the diagnosis they wrote because Jane did not have any chest or orthopedic problems that would have suggested TB. Instead, they proposed a different autoimmune disease, lupus, which would account for Austen's rheumatism, facial skin lesions, fever and marked fluctuation of these symptoms. Did cancer kill Jane Austen? Others, such as the author's biographer Carol Shields, speculate that Austen's family may have been affected by breast cancer, and that cancer was most likely the cause of her death. Lusser agrees that cancer appears to be a more plausible diagnosis since it was not uncommon in Austen's era. If Austen had cancer, the risk of it metastasizing would have been high. The only available cancer treatment, surgery, was very risky in Austen's day, Lusser observes. It depended on being able to find the tumor and get rid of it at a time when surgery could kill because of the risk of infection. Hodgkin's lymphoma is one of the other theories. Jane Austen scholar Annette Upfel considered Austen's full medical history and concluded that the author may have suffered earlier in life than most believe, noting she was particularly susceptible to infection and suffered unusually severe infective illnesses, as well as a chronic conjunctivitis that impeded her ability to write. Was Jane Austen poisoned by accident? In 2017, the British Library raised new questions about Austen's health when it tested 3 pairs of glasses that may have belonged to her and found that the glasses all had different lens strengths. According to the library, a consulting optometrist examined the results and said it was possible that Austen may have developed cataracts. He also suggested that the cataracts were the result of accidental poisoning from arsenic, a heavy metal that was common in the 19th century. Lusser considers this the least credible theory. Her writing desk contained the glasses, which may or may not have belonged to her. And though Austen was described as having weak eyes, poor vision can have many causes, not just arsenic-induced cataracts. So you can see how this is a leap and a stretch from desk to glasses to vision problems to arsenic poisoning, she says. Why diagnosing historical figures is so difficult. Scholars may use surviving medical casebooks and physicians' notes to diagnose historical figures in addition to examining old letters and belongings. But even these shouldn't be taken at face value, notes Mindy Schwartz, professor of medicine at the University of Chicago. What they prioritize, what they leave out, these texts show the biases of the time and the priorities that the physicians had when creating them. It also shows the limited resources of the time. For example, physicians in Austen's era would have made a clinical diagnosis, which took into account the patient's history and a physical examination. But this probably wouldn't have yielded a definitive diagnosis because many conditions have overlapping symptoms. We didn't have microbiology, CAT scans, or blood work at the time of her illness, so it would have been hard to make an accurate diagnosis, says Schwartz. Osamu Muramoto, senior scholar at Oregon Health and Science University's Center for Ethics in Healthcare, also points out, human beings are evolving, microorganisms are evolving, genes are evolving. So how can we say that disease X from 200 years ago is the same disease X as today? Even if you could posthumously diagnose historical figures, there is some debate over whether you should. Some people might be concerned that this is an invasion of privacy, explains Stephen Joff, Art and Eileen Penn Professor of Medical Ethics and Health Policy and Chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania. In my opinion, those privacy considerations diminish with time. However, he adds, ethical considerations nonetheless should factor into any retrospective diagnosis. For example, any genetic conditions have implications for the person's surviving descendants. Muramoto also points out that there's a risk in making diagnoses that carry reputational harm because they are considered taboo, such as sexually transmitted infections. Retrospective diagnosis of historical figures can also help normalize conditions that have been stigmatized for a long time. Let's say you can convincingly show that Abraham Lincoln had major depression, Joff theorizes. To me, that is actually quite destigmatizing because it shows how somebody can have major depression and yet be one of the most influential people in American history. Making these diagnoses can also help recontextualize the historical figure's life and work. Take 19th century philosopher Friedrich Nietzsche, Muramoto says. He spent almost a decade with very, very poor health, mental illness, dementia. Muramoto believes that tertiary syphilis is the most likely diagnosis, which, in my opinion, would explain his later writings' paranoid tone. This is likely not the case for Jane Austen. I wouldn't say her novels reflect the state of her health, cautions Lusser. Nonetheless, she adds, when Austen's symptoms were intensifying, she was starting to write Sanditon, an unfinished novel that features a send-up of hypochondriacs and quack medicine. Why Jane Austen passed away may never be known. But we do know that she could make fun of the illness, Lucer says, even though her own physical problems are getting worse. Jane Austen, one of the most beloved novelists in English literature, died tragically young on July 18, 1817, at the age of just 41, and even after more than 2 centuries, the cause of her death remains one of the most perplexing medical mysteries in literary history. Born on December 16, 1775, in Hampshire, England, Austen enjoyed a relatively healthy youth, with a life marked by long country walks, spirited dancing, and an active engagement in both family and intellectual pursuits. Even though she only wrote 6 books, timeless works like Pride and Prejudice, Sense and Sensibility, and Emma, she had a profound impact on literature. However, in the last year or so of her life, Austen began to experience a strange and progressive series of symptoms that modern scholars, historians, and doctors still struggle to make sense of. She wrote to her family and friends, particularly her niece Fanny Knight and her brother Charles, about her persistent fevers, exhaustion, rheumatism, skin discoloration, digestive issues, and an increasingly fragile voice and appearance. In a letter to Fanny dated March 1817, she famously described her skin tone as black and white and every wrong color, a cryptic but revealing phrase that has sparked theories ranging from adrenal disease to autoimmune disorders. Her niece Caroline Austen later visited her aunt and noted her ghostly pallor and fragile voice, commenting on a general aura of suffering that, while not defined by acute pain, was clearly draining her life away. In April 1817, a few months before she and her sister Cassandra moved to Winchester in hopes of securing better medical treatment that tragically proved to be ineffective, Austen's own recognition of the severity of her illness was evident in the calm and practical manner in which she made her will. "I have lost a treasure, such a sister, such a friend as never could have been surpassed," Cassandra wrote later in a heartbreaking letter about Jane's passing. "She was my life's light." Our primary sources for information about Austen's final months are the correspondence that was left over from her, her family, and their friends. However, the lack of detail in these letters is frustrating. Cassandra destroyed many of Jane's letters, possibly to preserve Jane's privacy and legacy. This unintentionally stoked endless speculation regarding Jane's illness. As a result, a cottage industry of retrospective diagnosis has sprung up around Jane Austen, with medical historians, scholars, and even practicing physicians weighing in on what could have brought about her early demise. The most enduring theory is that Austen suffered from Addison's disease, a condition first posited by British surgeon Zachary Cope in 1964. Addison's disease, caused by adrenal gland failure, leads to symptoms remarkably similar to those Austen described: chronic fatigue, weakness, low blood pressure, and skin discoloration. But this theory is not without its critics. In 2021, a pair of emeritus consultants from London's St. Thomas's Hospital, Michael Sanders and Elizabeth Graham, challenged the Addison's diagnosis, pointing out that tuberculosis was the most common cause of Addison's during Austen's era, and Jane showed no signs of the chest pain or orthopedic complications that usually accompany TB. Instead, Sanders and Graham proposed a different autoimmune disorder: systemic lupus erythematosus, or lupus. Many of Austen's symptoms, such as fatigue, fluctuating fevers, joint pain, and especially changes in her complexion, may have been caused by lupus. Additionally, lupus is characterized by a butterfly rash on the cheeks, which may have contributed to her face's wrong color, as she described it. Despite this compelling theory, no definitive conclusion has ever been reached, and other theories continue to swirl. Some have suggested Hodgkin's lymphoma, a cancer of the lymphatic system that could account for the general malaise and recurring illnesses she described. Biographer Carol Shields has posited that breast cancer, which may have run in the Austen family, could have been the culprit, especially given the limited surgical options available at the time and the high risk of metastasis. Surgery in Austen's day was extremely dangerous, with no anesthesia and no knowledge of antiseptics, making even simple procedures potentially fatal. Annette Upfull, another Austen scholar, considered the author's entire medical history and concluded that Jane may have suffered from a more systemic problem dating back years earlier, possibly involving chronic infections or immune issues, including persistent conjunctivitis which made writing difficult and may have masked deeper health problems. Even more controversially, the British Library proposed in 2017 the possibility that Jane Austen was accidentally poisoned with arsenic. This idea stemmed from an analysis of 3 pairs of eyeglasses found in her writing desk, glasses believed to have belonged to her, though this attribution is not certain. Each pair had different strengths, which optometrists interpreted as possible evidence of worsening cataracts. Cataracts in the 19th century could sometimes be caused by long-term exposure to arsenic, a substance present in many medicines, cosmetics, and even wallpapers of the era. However, most scholars, including Devoney Lucer, author of Wild for Austen, a rebellious, subversive, and untamed Jane, view the arsenic theory as implausible and speculative at best, pointing out that weakened eyesight can be caused by many conditions, and that linking cataracts to arsenic via unproven ownership of a few spectacles is tenuous at best. In addition, Lucer emphasizes that Jane Austen's novels do not show any obvious mental or physical decline, noting that the novel Sanditon, which she began in the last months of her life, was lively, satirical, and full of sharp commentary on hypochondria and medical fads, indicating that she had a clear mind despite her failing body. Indeed, Austen seemed to retain her wit and observational acuity until the end, making it harder for scholars to pin down a diagnosis rooted in neurological decline. The question remains, what really killed Jane Austen? And more broadly, can we ever really know what diseases afflicted people centuries ago? The field of retrospective diagnosis straddles the line between historical speculation and scientific curiosity. When trying to solve the mystery of Austen's death, modern doctors must rely on stale medical terminology, first-hand accounts, and ambiguous descriptions filtered through the early 19th century literary style. According to Mindy Schwartz, professor of medicine at the University of Chicago, we must remember that physicians in Austen's time lacked microbiology, imaging technologies, and laboratory tests. Only personal testimony and physical observations were used to make diagnoses. Even if today's specialists had access to Austen's body, which they do not, the genetic and microbial landscapes have evolved so dramatically that certain diseases might not even present the same way today as they did in the early 1800s. Osamu Muramoto, a medical ethicist, points out that while posthumous diagnosis can be illuminating, it also opens up thorny ethical questions. Should we be diagnosing people without their consent, even centuries after their death? What if the diagnosis carries modern stigma, such as syphilis or mental illness? Could these labels unfairly color our perception of a historical figure's accomplishments? Yet, as other experts like Stephen Joff from the University of Pennsylvania argue, retrospective diagnosis can serve an important purpose. It can destigmatize illness and provide new ways of understanding the personal struggles of people who accomplished great things. For example, if Abraham Lincoln indeed suffered from severe depression, as some historians suggest, then it only enhances our appreciation of his achievements. Applying that lens to Jane Austen, it's possible that her declining health may have influenced the themes of frailty, mortality, and human imperfection that run subtly through her later works. And yet, as Lucer rightly cautions, Austen's novels are not autobiographical and shouldn't be over-medicalized. Despite her physical decline, her characters were still full of irony, agency, and psychological insight, demonstrating her unwavering intellect. Ultimately, the mystery of Jane Austen's death remains unresolved, suspended between competing medical theories, historical gaps, and interpretive caution. Whether it was Addison's disease, lupus, cancer, chronic infection, or even arsenic poisoning, what we do know is that Jane Austen remained perceptive, witty, and graceful in her final days. Her final unfinished manuscript, Sanditon, pokes fun at doctors and health fads with the same precision she used to satirize class, wealth, and romance in her earlier works. Perhaps Austen knew the limits of medicine better than her physicians did. Perhaps she was even aware that her legacy would outlast any speculation regarding her passing. Today, her stories continue to inspire readers around the world. Her characters as alive as ever, even if their creator remains enshrouded in one of the literary world's most poignant medical enigmas. Jane Austen, ever private and poised, may never have wanted us to know exactly what caused her end. But in trying to understand it, we understand more about the era she lived in, the body she endured, and the genius she so quietly possessed.